Good morning, everyone. Welcome to day 3 of the Agency for Healthcare Administration's week-long webinar series for National Health IT Week. On behalf of the agency, I want to thank everyone for joining us this morning. My name is Chris Wilkie, and I'm the Health IT Outreach Specialist here at AHCA. I'll be leading today's presentation, and before we get going, just want to let everyone know who is viewing today that we are recording the presentation, so if you have to miss any of it, we'll send an email out with copies of the slides as well as a full recording of video and audio. Before we get started, just want to tell you a little bit about what we're doing for National Health IT Week. We've chosen to highlight a different area of health information technology each day. There are a lot of different HIT initiatives taking place in Florida, and today we are going to talk about the Encounter Notification Service. The Encounter Notification Service can help providers reduce readmissions as well as increase patient satisfaction, and we are going to highlight someone who uses our service so they can give their personal experience with it. Our moderator for today's discussion is going to be Pamela King. She is the Health IT Outreach Coordinator here at the Agency for Healthcare Administration. Good morning, Pam, and thanks for joining us today.
Thanks, Chris. Good to be here.
All right. Very excited about today's discussion, and especially our special guest. Our special guest today is Dina Lewis. Dina has over 18 years of healthcare experience with a focus in IT systems. She is currently working at Primary Partners, and she oversees the analytics department there. Hi, Dina. Also, thanks for joining us today.
Thanks, Chris. Happy to be here.
Dina, would you mind telling the audience a little bit about yourself and your role at Primary Partners?
Hi, everybody. Thanks for joining. I'm a long-time healthcare employee. I've been in healthcare since 1992. Some of the roles and responsibilities that I've had through the years includes registration manager, commercial billing agent, revenue analytics, health IT, skilled nursing, home IT, and now I currently work for a large independent physician group as the analytics program manager. I work with contracts for Medicare, Cigna, Blue Cross, and local hospital systems, and we analyze the data that comes in from the payers against our spends, our utilizations, and care management opportunities. Primary Partners has been around since 2011. We were one of the first ACOs in the country, and we started in 2012, and we've been going strong ever since.
Awesome. Thanks, Dina. Before I hand it over to Pam, just want to let the audience know that we are going to reserve a couple minutes here at the end of the presentation for your questions. Throughout the presentation, if you have questions, I'm going to try to address those through the control panel so you can type them in. Otherwise, we'll try to field a couple of those at the end of the webinar. And on that note, Pam, I'm going to hand it off to you and we can start our question and answer session.
Great. Thanks so much, Chris. And for those of you that are wondering, Chris and I have both evacuated from Tallahassee, so a hurricane will not interrupt this webinar presentation today. And so you don't have to worry about that. So Dina, thank you again for being here today and sharing with our audience and with us some of the little bit of information that you have, the knowledge that you have about the Florida Health Information Exchange's Encounter Notification Service. For those that are attending our webinar and don't really know what the Encounter Notification Service is, it is just a means of sharing health information, a thin slice of health information from hospitals in the state of Florida. And so there's 215 hospitals that share information on admits and discharges from hospitals. And then that information is return to subscribers of that service. So, Dina, can you tell us a little bit more about how that works and how that works for you at Primary Partners?
Sure. So each subscriber submits a full patient panel to Audacious Inquiry of their contracted covered lives. So they can only get alerts if they're contracted. They can't do it for their primary care physician's entire panels. So if we have a contract with Medicare, we can only submit those ACO contracted lives. Additionally, the same goes for commercial payers. So you send a full patient panel to Audacious Inquiry, and then Audacious Inquiry will load your panel, and then as admits are received directly from the hospital systems that they're with, it says on the slide 215 connected hospital systems are sending data over to Audacious Inquiry, and then Audacious Inquiry looks at those alert notifications to see if they match to your patient panel. If they match to your patient panel, then Audacious Inquiry will load it as, in my example, Primary Partners patient, and then we'll deliver it back to the subscriber. There's a couple options that you can have as far as delivery method. You can do some flat files twice a day, or you can do a real-time HL7. We have done, just a flat file. So it's received daily in the morning and in the afternoon in our direct mailbox for the state HIE. Then what we do is we download it into our environment, run it through some protocols that we have in place to get it out to the primary care physician offices. But each alert, when it comes in, it has that critical information that shows you where the patient went, which facility, what their discharge date is. It ties it back to that primary care physician, and in most cases it will give you a chief complaint or a diagnosis of why they presented to the ER or to the inpatient facility.
Wow, that's great information, and I just want to clarify for those of you that don't know, Audacious Inquiry is the vendor that operates as the operation of Florida's Health Information Exchange Service, and so that Audacious Inquiry that Dina was talking about is the vendor for the Florida Health Information Exchange. So you're getting this information back in filtering it down to your providers. What are the benefits of being able to get this data from these hospital encounters?
Receiving real-time notification is so critical in today's healthcare landscape. You know, healthcare has really shifted from being a reactive to a proactive approach. Before, we relied on the patient to call the PCP and notify them, hey, I went to the ER, I went to the hospital last night. And they don't always do that. They may call one of their specialists. They may not call anybody. So with the real-time notifications, the providers can take swift action to manage the healthcare needs of that patient after they've been discharged. They can immediately check on the health status of the patient. How are they feeling? Are they having any issues? They can talk to them about their discharge orders. Where are they being sent? Are they being sent home with orders? And review any medication changes that may have happened in the facility. I think the biggest shift too is that these alerts, we're delivering these alerts straight to the physician's office, right? We're streamlining it. We're getting hospital information from multiple facilities and presenting it back to the physician's office in one streamlined report. Okay, so this reduces the staff time that it takes at the physician's office. And most regional areas, you have several hospital systems that your patients may be presenting at. So your staff, would traditionally have to look at physician portals for multiple facilities to find out if anybody even went to the hospital. So this is a great reduction in staff time and FTEs. If your organization has a care management department, or even have care managers at your physician offices, they can quickly review that daily list of ER hospitalizations and say, hey, I just talked to her yesterday. She didn't even tell me she was going to the ER. She didn't tell me there was an issue. So they can quickly call those patients and say, hey, Ms. Jones, I saw you were in the ER last night. What happened? And then from there, they can discuss again how they're feeling. Do they need to come in and see the physician? Were there any changes to the medications? And doing items such as that, you're going to reduce avoidable readmissions and overutilization of services.
And you gave us some just some general information, but do you have any specific stories that providers have shared with you on how the service has helped patients?
Well, I would probably say the majority of the success stories probably stem from medication changes or reconciliation. Chances are when they go into a hospital system, especially if they're an inpatient, they have an acute life event. And so therefore, if they're on medication for a chronic condition, a lot of times those are altered, maybe even changed in some cases, or they're adding to. And unfortunately, with the hospital systems, they don't always have a full medication list of the patient. The patient may not remember. They may have been unconscious when they came in. So there's a lot of factors, but the hospital systems don't always have the full patient view. So it's really helpful for the PCP to follow up with those patients and do a full review of their medications.
Well, and we know that medication is a significant issue, and that reconciliation of medications is crucial to any patient care. I know I've heard stories of patients that have been taking warfarin at home, been prescribed Coumadin at the hospital, and went home and took both, and of course ended up back in the hospital. Just because they didn't know what those medications were for, and that it was contraindicated to take both. So it's great to hear that this service is actually providing that benefit and that basically information is needed to make that review, so that it can be done, to know that it can be done, especially when the primary care provider can be brought into that loop.
And I would say, there's other ways that the physicians have utilized it to help the patients. They're delivering the admission notification, so they're not always acting at the state of discharge. So if they see a patient came over that they're very familiar with, that got admitted overnight, sometimes they'll pick up the phone and they'll call the rounding hospitalist and say, hey, you know what, she was just in the hospital last week. I want to talk to you about her care, and let's discuss a care plan. And a lot of times that can reduce the number of days the patient may be admitted to the hospital, or it may avoid unnecessary testing. I know with our data personally, we've seen a direct impact on readmissions once we implemented the ENS subscription. We started originally with a targeted geographic area where we didn't have a lot of insight on where the patients were going. We didn't have a direct ADT feed or anything like that. So we started with a small 4,000 live panel in Kissimmee, Florida. In just 1 year, we saw a decrease in overall ER visits by 8% and 11% in readmissions. So the ROI on that is amazing. The cost of subscribing to the ENS system is really minimal. And so we saved about, just in that scenario alone, in readmissions, we saved about $280,000, and it only cost us $10,000. So that's a pretty impressive ROI.
Wow, that is awesome. That is wonderful. And that's one of the things that we are constantly asked about health information exchange is what is the return on investment, and you've demonstrated that just with a small regional area, and just imagine the benefit to larger areas and what you've seen in your area. And did you learn anything about, or did the providers learn anything about their patient patterns, and have they been able to, if they're able to reduce readmissions, is there something that they glean from just getting the information? Is it just being able to reach out to the patient and talk to them and get them into the office?
I think it's more communication, having that conversation with that patient. It's really the biggest factor. Just picking up the phone and talking to a patient. Chances are this patient was discharged. They're most likely still not feeling well, maybe a little confused about their discharge instructions. So just communicating with the patient, finding out if there's a need for the patient, or just saying, hey, the doctor wants to see you. That goes a long way in just reducing, the readmissions, the unnecessary readmissions. And honestly, the financial burden on the patient for all of these healthcare costs is another benefit that we see. A lot of, nowadays we know most of the insurance plans have such a high deductible. These patients can't afford, these life events when they could have been avoided. So just having that information, picking up the phone, calling the patient. Maybe they don't have a ride to get to the specialist that they need to go to. Maybe they were referred to a specialist 25 miles away, or maybe even 10 miles away. But there's somebody in their backyard that could honestly, provide that same care for them. And the primary care physician and their staff, most likely, they understand this person has financial difficulties. Maybe they don't have a car. Maybe they don't have that support system to drive them to their needed appointments. So, that conversation could lead to anything. But that conversation is the key point to have better outcomes for the patients and to reduce some unnecessary testing or admissions.
Right. And the information they get, I know the information you get is just a small piece of data. So what all is included in the information that you get from ENS? What is included in that?
I would agree it is a small piece of information that can have just such a large impact. For the most part, we'll get, obviously, the patient's ID, we'll get the hospital system that they presented at, we'll get their date of birth, their address normally comes back through, and if there's a phone number comes back through. Majority of the hospital systems are sending why the patient went. That is a requirement to participate. However, some of the hospital systems, their data infrastructure, it makes it difficult to send it. So they are working avidly trying to be able to share that information. So when you present your roster, you're presenting the majority of the demographics for the patient. However, when it comes back from the ENS, they actually send you what the hospital has. So a lot of times maybe you've lost touch with a patient. Maybe you've tried to reach out to a patient 4 or 5 times. You can't reach them. Now the hospital's sending you back saying, hey, this is the phone number that we have on file, which is nice because maybe you haven't been able to reach that patient. And then if it's a hospital admission, they'll send you who is who is the attending. So if you needed or wanted, desired to reach out to the hospital system, you could say, you know, Dr. Jones is the attending, and I need to have a consult with him. I need to have a conversation with him. There are some technologies in the area. There's some apps. I don't know if a lot of people on the phone are with Orlando Health, but they have Perfect Serve, which is an app where you can communicate with some of the hospitalists and even the specialists in your area. So you can reach out directly to some of those and say, hey, can we talk about Mary Jones's case? So it's a lot of good, it's a little bit of information, but it's enough to get you, hitting the ground running, either calling the patient, calling the hospital, or calling the person taking care of them.
Wow. And so are there any challenges you've been able to overcome by using this information, even though it's a small bit?
Well, some of the early challenges that we had, a lot of them have been, they've been ironed out. We started this journey back in 2015. So some of the, and probably it's still a challenge for some folks on the line, but creating that original patient roster and keeping that patient roster up to date. So obviously, as your patient attribution changes in your contracts, you have to submit an updated patient roster. Now with Medicare, if anybody's on the line with Medicare, they don't send you the patient address. With Cigna, Blue Cross, and some of the others, they give it back to you, they give you the patient address. Well, the roster, one of the mandatory fields, or I wouldn't say mandatory, because you can submit a panel without it, but your match rate, your patient match rate is not that great. It has improved over the years, but if you don't have a patient address, it doesn't match probably to the level that you'd want. So unfortunately, Medicare has not sent us the address, so that relies back to our practices. We have to go back and say, we need the address for all of your Medicare lives. Pretty easy to do if you're on a single EMR system, but in our case, every provider is independent. They have full autonomy to pick the EHR that they like to work with. So we were extracting data from 20-something EMRs, and in most cases, the demographic report, which held the patient address, doesn't include which payer it was. Or what the subscriber ID is for the patient. So then we were having to combine multiple lists, and that was probably the largest challenge. But I did hear the other day on the Medicare CCLF user group that Medicare is going to start sending patient addresses in the claim files. So that's a bonus.
Oh, okay, that's great for the future.
Yeah, it is great. It's going to help a lot of people out, especially if they're connected with the HIE. Like I said, with Cigna, Blue Cross, and some of the other payers, super easy to create that patient panel and get it submitted. The other challenge that we had that I know that Audacious Inquiry has worked really hard on is not all of the admission types were being sent by the hospital systems. So there are segment IDs that are associated with each admission type, A01, A04 messages. And like, for example, some hospital systems use what we call the quick registration. Patient presents maybe to the emergency room. They do a quick reg so they can get an armband for the patient. And then a little bit later, your registration clerk goes back and they do a full admission. Some of those alerts were not coming through because it's a different segment ID. So I know that the Audacious Inquiry has expanded that, and we're now actually to the point where we're getting update messages. So it's really
that
great.
was a great improvement that was made. to the encounter notification service to provide those updates so that there is a capture of those admits, and even, you know, when patients are discharged and there's some final discharge information added in for those transitions. So for current users and new users to the service, that's going to be a great benefit to have that additional information. You know, we are 4 minutes out from the half hour, and we did promise the audience an opportunity to ask a few questions. So I'm going to turn it over to Chris to see if we have any questions that have been typed in, or if there's anybody that has questions.
All right, thanks, Pam. Yeah, just to remind everyone, you can either type your questions in, or on the attendee control panel, you can click raise hand, and we can verbally take your question. Let's see, it looks like we have a couple. All right, we have, someone wants to know, do the notifications currently include lab work or tests that have been administered to the patient?
So the information, as Dina talked about earlier, this is Pam, but that information is really just a slim slice of information. It doesn't contain lab results or anything like that. That's something that you would get from a CCD through query, or, you know, this information is just a very slim slice of information that provides demographic information for the patient, what type of admission or discharge, whether it's emergency department or inpatient, admit or discharge, I should say. And then in most cases, the discharge diagnosis. And I'm going to ask Dina to correct me if I've missed anything.
No, I would agree with that. It is part of the overall strategy and goal that we're all working toward, is to figure out how we can get maybe a discharge summary or some of the testing that's done while they're in the facility back to the primary care. That is a strategic vision for all primary care physicians, and it's just the method of how we're going to be able to do that is still not defined. I know some of the local hospitals around here are willing to do a direct email to the EHR. So I didn't know if that's a possibility for others that are on the line, but agreed, this is that, I mean, that's the end priority and the end goal, is to get that summary.
And that's actually one of the things the Florida's Health Information Exchange and the vendor Audacious Inquiries is working on some solutions that might tie that a discharge CCD or a discharge summary CCD document back with the alerts in the future. Of course, that would be an additional service. It wouldn't just be your basic encounter notification service. It's, you know, the encounter notification, the name describes it, right? It's just the notification that there's been an encounter by your patient. And so there are solutions that are being worked on in the health IT world, and so hopefully we'll be able to have more information in the future. The Florida HIE is also working to add additional data sources. So right now we have 215 hospitals, but we're working to try and get long-term care, the skilled nursing facilities, rehab facilities to share their data as well, to expand the information that can be provided or given back to those PCPs to better help with that coordination of care. Do we have any other questions, Chris?
We do have quite a few that have come in. Unfortunately, we are at 10:31 now. So for those of you who have asked questions, I will respond to them via email. And I just want to remind everyone else who's watching, if you do have additional questions, you can send them to the email address listed on this last slide. It's flhii@aka.myflorida.com. We also have our website available for more information, florida-hie.net. I want to remind everyone that this is a week-long series. So tomorrow we're going to be discussing the Electronic Health Records Incentive Program and how that promotes interoperability and the adoption of electronic health records throughout Florida. Dina and Pam, thank you so much for the discussion today. It was great to have you both on the line.
Thank you. Appreciate it.
Sure. And to everyone watching, thank you for your attendance, and we will see you tomorrow. Have a great day, everybody.